Hi Sean, we're going to apply dressing to the posterior portion of your elbow. Frequently, posterior elbow burns are difficult to dress. The arm goes into extension or flexion. If they're dressed in extension, the patient will have difficulty moving into flexion when the dressing is dried. So you want to make sure you dress it in flexion. So what you want to do is cut the dressing appropriately. If you just apply the dressing in flexion, you see that there's bunching, and this bunched area is going to take longer to dry and it won't adhere as quickly or as nicely. So you want to cut it to match this area. So you want to fold it once in half and then in half again, and just try to line up all the corners and make your cut where you want the dressing to be removed. I'm going to place this across the bicep, and this is going to curve nicely over that elbow, that joint, and you'll see how it eliminates that bunching up. And this again is for a posterior elbow burn. So you want to encourage the patient to stay in this position. Once you get that in place, you want to wrap it with the Curlex. You just want to make sure that the dressing is in place in all areas, it doesn't fold up, and that it's just dressing that's contacting the burn, not the gauze. And we're going to cover that with netting as well. And you want to encourage your patient to try to maintain this position as much as possible.